Welcome to Latinas Be Like Us, a new episode today. And I'm in awe of the guest that I have today. Denise is such an incredible woman. She is the co-founder of Pre-Health Dreamers, and she has a really powerful story to share with us today. She's also featured in Forbes 30 Under 30, and she was a 2016 recipient of the Paul and Daisy Soros Fellowship for New Americans. I want to remind everyone that if you want to learn more about Latinas Be Like Us, you can visit latinasbelikeus.com. And you can also leave a donation. Your donations are very important to us so that we can continue to create episodes. So Denise, welcome, and thank you so much for taking the time to talk to us today.
I'm really happy to be here and honored to join the episode as well.
Thank you. So Denise, talk to us about your journey and how did you decide to start your project?
Yeah, so a little bit about me. I was born in Mexico. That's where my family's from, and I immigrated to the United States in 1990 when I was less than a year old to Fremont, California. And that's where I was raised and grew up for most of my life. I went to UC Berkeley, and that was an incredibly difficult time for me, not being able to have access, for example, to federal or state financial aid, given my status as undocumented. I had to work long hours as a waitress in order to pay for my help pay for my tuition. And I also had this dream of becoming a doctor because I saw a lot of people in my community who, unfortunately, died or became really sick, and I saw them not being able to go to the doctor because of their either they're low income or they're undocumented. And that and my mother's own health problems really inspired me to be a doctor. And I felt like I could give something special to the medical community and to give back to my own community. And so the issue was I had absolutely no idea how I would pursue medicine as someone who is undocumented. And I asked advisors in my college if they knew anyone who had done this. And answer after answer, it would constantly be no, I've never seen this be done, or discouraging, like, that sounds a little bit too high. Why don't you think about doing this other thing instead? And that became incredibly discouraging. I was also felt very alone. I didn't really tell other people about my status. And then I met a group of other people like me, and that changed my life. The organization is called Immigrants Rising. They're a nonprofit based in the Bay Area. And I got a scholarship from them, and they connected me to other scholarship recipients, Angel and New, who also wanted to be doctors and scientists. And so that for me was just that moment where I felt like if we could do this together, if we could figure out how to pursue this journey together, then maybe we could share all that information to other people, as we imagined there were so many other people out there who were alone and facing challenges individually. And so, like many things, we never thought about starting a nonprofit. It was a small idea at first. We really just wanted to build a community. And then we realized that while we got more and more information, we realized we're never going to be medical professionals if we don't change the law. For example, in the state of California, back when I was applying to medical school, you couldn't be a doctor because you needed a Social Security number in order to obtain a medical license. And so that's when we started the advocacy component. We started talking to legislators and other organizations. And at the same time, we started getting more significant funding for Pre-Health Dreamers, and people saw what we were doing and they said, this is important. And long story short, we now do a lot of different issue areas. So Pre-Health Dreamer serves both individuals in California, but we expanded nationwide. We have members in all 50 states, and we've been involved in more significantly advocacy at the state level in California, but we've also partnered with other organizations across the country, and we help our individual members in any state. So the website is prehealthdreamers.com, and that's how we started.
Denise, that sounds like a very important cause. Mm-hmm. I want to go back to your experience and that feeling of not having that support and not knowing where to go. But what is really inspiring from your story is that you persevere and that you continue to ask questions. So where did you get that passion? Where did you get that drive to continue to ask questions and to not give up because somebody told you this cannot be done?
My sister teases me that she thinks I picked the hardest career and then went for it. I would say there's a couple of things. One is that feeling of seeing my family go through healthcare problems themselves, and in a sense of anger and frustration that they deserve healthcare and they deserve medical providers who speak their language and who have a similar background. That was one big motivation of our community deserves doctors who can identify with. And so that was one motivation. The other motivation, my parents have always instilled in me, seeing them go to work day in and day out and working multiple jobs. For me, it felt, I wouldn't say easy, but it felt like if they are working so hard every day to pay the rent, the least I can do is go to school. and it wasn't that easy, but I just felt like watching their work ethic is what inspired my own perseverance. And I see that every single day. Even the patients that I take care of today in the emergency room, their stories are amazing. And it feels like the least I can do is be the best doctor I can be for them. The other thing is I had understood, for example, in education, that it feels like K through 12 education is accessible to everyone, regardless of immigration status. And there's a sense of anger and frustration that also I felt thinking, well, we are able to get educated in up to high school, but then what after that? And so I think that feeling of frustration and this feeling that no, education should be accessible beyond K through 12. It should be accessible in the community college and the university and in the professional and in the medical field. And so it was, I would say, this combination of anger, but channeling that anger and frustration into something productive is how I've been able to, I think, drive that push and consistency. And all of that is important. I would say what's also extremely important is surrounding yourself with a community who feels the same way that you do. And Angel and New felt a similar frustration, but similar passion and similar hope. And I think you need all three to be able to make change.
Yeah, obviously you have the passion, you have the drive, and you show results by getting to where you are now. You've mentioned a couple of the challenges of what it is like for an undocumented person to get access to healthcare, like the language, like people that have similar backgrounds. But what are some of those other challenges that some people might not understand because they are not part of that community of undocumented immigrants?
Wow. Yeah, so there's so many challenges. I'll highlight a couple that come to mind that I think really drove me to do the work that I do today. One of them is, we have healthcare benefits through federal programs, and we also have certain healthcare benefits that are at the state level. For example, there was a woman that I met a couple years back, and she had a child with autism who was able to obtain certain healthcare benefits in their state. And she said, and she, she's undocumented, her family's undocumented, and she needed to move for economic reasons to a different state. And so her fear was losing all of those health benefits for her child if she moves. And so that's when I realized how significant our healthcare system is, not only at the federal level, but at the state level. And in California, I, after the full implementation of the ACA and the expansion of the Medicaid program in California, the remaining uninsured was predominantly, or is predominantly, or a significant number are the undocumented community. And so that for me was so eye-opening that a big group left behind in our healthcare system are undocumented immigrants. And so what that means is if you have diabetes, you will have a hard time obtaining your insulin, or you will have time getting podiatry appointments, which is incredibly important to take care of your feet. And you can't have access to appointments to see the eye doctor, as diabetes can have impacts on the eye. And that for me was really important in understanding how you really need providers who care about these nuances and care about this community to advocate for them, or else they will be left behind. No one else is advocating for them if more physicians and healthcare providers and people in the medical system don't speak up for them. And so that's one thing. Another issue is around the challenges in obtaining access to health insurance. And as I mentioned, the policies vary state by state, but even for example, my mother, this was about over 10 years ago now, she had a healthcare condition where she needed surgery, and she was not able to obtain health insurance, unfortunately, and she ended up immigrating to Canada. And when she was in Canada, thankfully, she was able to get the surgery that she needed. But as a result, I didn't see my mother for a decade. And that led to family separation. So I think another important consequence of this issue is the family separation that happens, or these dynamics that you have to make choices between your health and seeing your loved one, or your health and paying rent. And those are impossible choices to make, and choices that most people, thankfully, I don't think have to make, but they are a big issue, not just for undocumented, but we still have gaps in our healthcare system. Yeah, I'll highlight those too.
Thank you. Now that you mentioned those challenges, and like when you're talking about separation, family separation, that is huge, and that is something that the immigration community, not only undocumented but documented, experience. And it's quite often, in my opinion, overlooked. It's not really mentioned in the discussions that are in the important places in power where they need to be. Yeah. So how is pre-health dreamers bringing those conversations and trying to educate the public about the importance of really finding solutions so that families, because family is an important center of the economic power and the economic system of the United States, how can we make sure that these families are no longer separated?
Mm-hmm. Yeah, you bring up a really good point, and one that feels, again, needs this ongoing spotlight because it is so important. And my family was separated for over a decade, and those were some of the hardest years of my life, not being able to see my parents, see me graduate from medical school or graduate from college. And so Pre-Health Dreamers, as I mentioned, has a couple different areas where we do work for our community. And one of them is in the advocacy space. And as I'm sure you've heard, the narrative is often portrayed in the news as the quote unquote high achieving dreamer, came here no fault of their own, as I think those might sound familiar. And so I think one way that we try to think about this issue is we don't try not to separate the narrative of saying, okay, well, Pre-Health Dreamers is about these high achieving group. No, it's that is not how we present ourselves. Like, Pre-Health Dreamers is about educational access and serving our community. And I hope that I highlighted in my story how important my family is to not only my success. I didn't do this on my own. Absolutely. This was a community success. And so trying to bridge that gap, trying to wash away the high achieving dreamer narrative, and in all conversations, trying to be very intentional about the work that we do is for not just for us, but it is for everyone. It is for an entire community. And I think when you start changing that narrative between, there's the dreamers, there's the parents, but when you stop sort of siloing these groups, I think that's when you can have conversations and policy that is more reflective of a family unit rather than, the children who came here before age 16. And I would say that that's one really cool example in California, for example, when we were lobbying for SB 1159, which is a bill passed in 2014 that allows professional licensing. It's what allows me, for example, if I wanted to practice in California, to become licensed. That bill not only applies to medical licenses, but 40 professional licenses under the Department of Consumer Affairs, including cosmetology, for example. Mm-hmm. And so, again, we are advocating for, the issues that are important to Pre-Health Dreamers and that impact our members, but also what can we do to advocate for our community at large?
Yeah. And I mean, this is Latinas Be Like Us. This is about Latinos, and family is an important issue for Latinos. Our families are not only, where we live, right? The house that we stayed in, but they provide us support. They are there for us. They work hard for us to get where we are. So to us, family it's very important. Mm-hmm. You mentioned that it was about a decade that you didn't see your family.
So my family, because they had been undocumented in the United States for a certain period of time, they triggered what is called a 10-year bar when they left the United States. And they left for numerous reasons. I'd mentioned my mother's health condition was one of them. And so even if they became Canadian residents and then Canadian citizens, they weren't allowed to re-enter because of their background as undocumented in the United States. And so they were able to apply for a waiver to re-enter to the the United States eventually. And it was, I mean, an absolute journey just trying to find an immigration attorney who specialized in border immigration law. I found someone really wonderful through a friend who connected us. And it was literally a dream when I met with her online, and she said, yeah, like, I think we could apply for this waiver. I think it could work. I just didn't believe her. After being separated from my family for so long, I had no idea when I would see them again. And for her to give me that assurance that, like, oh no, I think this should be okay. I've done this before. And so my parents submitted their waivers, and I want to say it was less than a year later that they were approved, and can now come into the United States. So because I'm a DACA recipient, I still am unable to leave, but they've been able
now
to.
Your parents can come and visit you.
Yeah.
That must be a relief.
Yeah.
And I'm glad that you were able to find someone that walk you through that process. That must have been also very stressful, and also not knowing if it was possible, right? Because you think they left, there's nothing that can be done.
Yeah, I mean, that's what I assumed, and this was a little ray of hope, and I didn't want to have my hopes up. And seeing them again, and just simple, small things. I remember for so many years, all I wanted to do was have cake with my mom.
That's beautiful. And those moments are very special. Just having cake with your mom, or having a conversation with your mom, just going for a walk. Mm-hmm. That is part of being human. That is part of having a healthy experience of what it is to be with family. Mm-hmm. And I'm glad you can rely on your family for that. And it's beautiful that you are able to reunite with them, and that they can come and visit you. I want to ask now, how can people reach out to Pre-Health Dreamers, and what are some of the services that you provide for the community?
Yeah, so we have a website. I think that'll be a good place to start. So it's www.phdreamers.org. And there's a couple of different tools. It's not just for, so one, we serve individuals who identify as undocumented DACA recipients, or don't have a social security number, so just kind of an array, not just DACA recipients. And we do have a way to join. So there's on the website, there's a way for you to fill out a survey, and then you'll get connected to our listserv and be able to get regular updates through our emails. And that's a really good way to get started and get plugged in. Separately, we do have programming, and this is particularly for individuals, I would say, I think we've had as young as high school to college, or folks who finish college and want to be in the healthcare profession. So anything from nursing, physical assistant, medicine, dentistry, a PhD in the science. It's a big,
any of the science.
Big description. And we have that specific program to help individuals obtain different skills. For example, writing personal statements, connecting with individuals who can help guide them through the application process to their individual programs, understanding how financial aid works for graduate school, understanding how professional licensing works. There's so many questions that if you think about sort of traditional career advising or counseling, that is now sort of very targeted to our undocumented community. In addition to that, we do have a lot of resources on our website. So, for example, a list of scholarships for individuals who are either in college or already in their graduate programs. For example, the fellowship that I received, the Paul and Daisy Soros Fellowship for New Americans, is open to individuals regardless of immigration status. And so that's one of the scholarships on our list. And it's an incredible scholarship. It awards $90,000 over the 2 years, which is an incredibly enormous help. And it also gives a really amazing community to also get connected to. We also have resources for pre-health advisors. That's a really important audience that we try to serve as well. And we have a more of a targeted group for health professions advisors. So guiding them how to be advisors and advocates for their students. Because I think that's a really important way to spread the message. And yeah, so those kind of a summary of what's on our website and summary of some of the work that we do. The last umbrella is around advocacy. And I would say that work is both, as I mentioned, specific to the state of California. We work with a lot of organizations in the area. But for example, when possible, we try to do work at the federal level as well. For example, I was recently invited to the State of the Union a couple of days ago, and I was a guest of Senator Padilla, and I was on a couple of media interviews and trying to show the importance of immigration reform and immigration bill that includes a pathway to citizenship for undocumented people. So
that's incredible. I mean, you're doing the work that needs to be done. Denise, you mentioned that you study medicine, but I never heard what kind of doctor are you?
Yes. So I studied medicine at Mount Sinai, and it's a medical school in New York City. And I'm currently in a program with my husband, actually. We're in the same program in emergency medicine. So it's in Boston. So okay. I'm an ER doctor. I'm the first doctor you see when you come in.
Denise, to wrap it up, what do you want people to know about you in a couple of sentences?
I want people to, one, understand the importance of the family unit, as we described when talking about immigration reform, immigration policy, and any policy that impacts this community. It needs to be inclusive of everyone. And I think that's the way that we help prevent family separation, and it is humane. And the other thing that I want people to remember is I started pre-health dreamers when I was right out of college. And a lot of people told me I was crazy or I was too young, or I had no idea what I was doing. And I actually had no idea what I was doing, but I did have a lot of people to ask for questions, and I asked where I could, and I found a community, New and Angel and Immigrants Rising, who believed in me and who believed in my mission. And I just want to encourage people, no matter what stage of life you are, you don't need some fancy degree or some experience in order to push yourself and reach your dreams. I think you're more capable than you think you are.
You definitely are, and you were capable, and it's been an honor. Thank you for sharing your story with us. And please, where can people find you? Where can they go and visit social media or help pre-health dreamers?
Yeah, so I would say through our website would be really incredible. We are actually having a fundraiser in a couple of days, but we have our fundraising page open at all times. So any donations are incredibly welcome to Pre-Health Dreamers. Any collaborations, we're always interested in working with institutions to help programs be more supportive of our community and just understand it is possible. It is possible to become a doctor who has DACA, and I'm a living example of that. And then, yeah, my Instagram is at Den_Rojas, if anyone's interested.
Thank you, Denise. It's been such a pleasure and an inspiration. And we'll be in touch, and we'll keep an eye on your Instagram and all the great things that you're doing for the community.
Thank you. Thank you so much for having me.